Yeah.
Mine's like food. You have like, that's where you go. Cookies, wafers, pies. You have like.
They must have had, my instructors must have been duped many times by these presentations, so they're like, these have to be in place. First of all, I wanted to welcome you guys for coming in. I know I stole you from Madonna. I don't know how much Madonna explained to you, but one of my requirements, I'm going to the University of Flint. I'm going for my mental health. And one of the requirements is a presentation brought to you guys at the entry-level nursing to talk about culture, because we know you guys are learning all this good stuff. We're learning about, how to care for a patient, how to be a nurse. But we have to make sure that we incorporate culture, because if we don't have a culturally congruent plan for our different patients, then our care isn't adequate. What does culturally congruent care mean? Yeah, absolutely. And we are back in 50 years ago, we would care for a population that was basically looked the same as us. Everybody looked the same. But now in the 21st century, our care to our clients, our patients, our families are getting much more diverse. Populations are increasing. And so that is the point of this presentation. Okay, so culturally competent teaching. So the presentation objectives, I'm sure you've seen these objectives before. We're going to examine transcultural nursing. What is transcultural nursing? Identify beliefs or values affecting healthcare found among Hispanic cultures. Because I picked Hispanic cultures because they are the second leading subgroup in America right now. So chances are you guys are going to take care of Hispanic patients. Dr. Nielsen-Conrad was the person who developed transcultural nursing. So what does that mean to us? Well, in the 1950s, she realized, boy, there was really a breach of how we cared for our patients. People just focused on caring for them. They didn't take into account all the other dynamics that go into caring. So she recognized failures of caring. Can you care for someone if you don't know their culture? Can you provide care if you don't know their culture? Thoughts? Comments? You can provide basic care. Yeah, you can. But it's not going to meet the high standard that is required. Does that make sense to you guys? So Dr. Langener was the one who developed this culture, and she's like the founding mother of transcultural nursing. So again, she recognized there was two pieces missing in the 1950s: care and culture. We did everything right. We checked their vitals. We provided basic care to them. Everything with doctor-prescribed medication, we did that. But those pieces were missing, and the patients didn't recover as well. That's okay. I have to flip it back and forth. I hear you, Marty, you're laughing. So she developed this culture. See? I'm blaming it on you, Marty. She developed this culture. She took previous learned knowledge. She went and got her doctorate degree in anthropology. She sociology. She said, boy, nurses we are just focused on providing quality care, the basic care for these residents or these clients. So she created it that we were going to incorporate cultural beliefs and values, health and illness systems, and nursing client interaction. Because we can do everything right, but if you as a patient are not buying into it, is it culturally competent care? No, it is not. We can develop the best plans, but if it doesn't fit our client, it's not good enough. So the cultural care theory assists the nurse to avoid ethnocentric assessments, providing that represents the principal cultural perspectives. So what does that big fancy lingo mean? Providing care that is based on culturally congruent care. So can we think of times where we miss the mark caring for our patients culturally? How many of you guys work in the nursing home? Okay. Are there certain kind of cultural practices that they do? Chances are you probably don't even recognize it yet. What about during Lent, where they don't eat meat on Fridays? Any of you guys experience that? Absolutely. So if we're offering them, if the only thing on the menu is meat, they're not going to eat. So that's not providing culturally care. So that's basically what that means. So she developed this Sunrise Enabler, and it takes in various factors into this model. So it takes a variety of things in. Generic care. What is generic care? Generic care is considered like how your grandma used to take care of you. You know, what are the old wives' tales? Nursing care and professional care, and kind of merging them together. Professional care is what you guys are learning about now in the classroom setting. So the social structures and dimensions of the Sunrise model focuses on generic and again folk systems. Like for example, some of the Hispanic population believe that their child will get an ear infection if their hat, if you don't have a hat on that child, they'll get ear infections. How many of you guys have heard your grandma say that? Absolutely. That's a shared belief by many. Is there any evidence that suggests that cold air in the ears are going to cause an ear infection, an otitis media? No, there isn't. So that would be an example of generic or folk system. So social structures, many factors influence the care. Family, groups, organizations through language and environment. And when we talk about groups, we will talk a little bit about how Hispanic families, they're not just the nuclear family, it's the extended family. It's godparents. So the Sunrise model incorporates all this to make a holistic. Have you guys heard the term holistic? It's incorporating everything in. Everything in. And so that's what we're going to focus on with the Hispanic culture, is incorporating everything in. So one of my requirements was to do a cultural interview on a Hispanic person. I had to be kind of broad enough to, I couldn't just pick someone I knew. I had to pick someone who was a stranger. I used to live in Arcadia, where there's a large Hispanic population, many young men coming into that area to work at the factory. How many of you guys are familiar with Ashley Furniture? They have a huge Hispanic population. Oftentimes first generation. You know what I mean by first generation? They're the one. They're working on their documentation. They're undocumented workers coming into Ashley. So when I worked in Arcadia, I worked at the local hospital. We saw a huge influx of Hispanic population. And remember, they're number 2. They're number 2 in the largest population of subgroups in America. So chances are you're going to take care of this population in your practice. So I chose, he was kind enough to meet with me. He did not speak real clear English. His primary language was Spanish. He was a male. He was married. He was married to a Caucasian female. He was expecting his second child. He was an industrial worker. He migrated from Mexico about 5 years ago. So, and we'll talk about how his process was of crossing the border and how incredibly scary it was. So that was my informant. So that was, initially for the assignment, I had a research about Hispanic population, so it was considered a holding tank. And then to do this assessment on this gentleman, this cultural assessment. So he has only been in the country 5 years. So what do you think his experiences were like coming to a new country? Joel, you might have, what do you think his experience was? Culture shock, absolutely. Absolutely. He couldn't speak any English when he came he has 5 siblings in his family. His 2 older brothers left once they were turned 18. They left to America. And so once he turned 18, his option, he wasn't, he didn't have that system of, what do I want to do when I go to school? None of that. He was going to America to make money because his parents both have hypertension and diabetes, and they have young children, still 2 young daughters at home. So he had to go to America to support his younger siblings in his family. And so what happened is to get the money to come across is very expensive. So his parents mortgaged, so a third mortgage out on their home to pay the coyote. The coyote is kind of the broker. Get your documents to come to this country. And he said he was so terrified when he had to cross the border, because if he got busted, his parents would not be able to pay the coyote back, and it would be very difficult to come back to America. So and he was 18. Can you imagine coming across the border, undocumented, not knowing the language, and being scared to death? And so that's what he did. And he said there was never a thought to say, oh, I really don't want to do this, or I'm scared. It was an expectation. Men work to support the family. That was his role in the family. And he was number 3, so his brothers already did it. His brothers had been successful. So a lot was riding on him. Questions? So during the cultural assessment, kinship was very important. He didn't see himself as a separate entity from his family. His family were his godparents, his parents, his sister, his wife. It's a large nuclear family. Solidarity and hard work. That's what men do, is they work for their family. That was his sole purpose in life, was working to support his family. So I was, talking. I noticed that in my experience, I said, can you tell me a little bit about eye contact? Because I had read a lot about direct eye contact. Direct eye contact is considered in the Hispanic culture as a sign of disrespect. So that's important to know as a nurse. When you're doing teaching, they're not making eye contact. We value eye contact. Our culture values eye contact, don't we? What do we say by eye contact? I'm listening. I'm engaged. Where the Hispanic culture sees it as a sign of disrespect. So you as a nurse, if you were doing distance teaching to a Hispanic, he was Madonna. So that was something that was good for me to know, because I thought, oh, they're not listening, they don't care what I have to say, and a lot of research suggests that it is a sign of respect by not showing eye contact. Handshaking, men handshake, where women may pat themselves on the back, but men handshake, and that's a sign of respect. I'm shaking your hand. There's a belief that a lot of Hispanics, 90% of Hispanic culture, identifies themselves as Catholic, but their Catholicism is much different than ours is in America. They're more symbols and more the angelic type, and their belief is different. But so that was something very important. However, they're finding that the younger generation are not, they're the master of their own destiny, and they're kind of throwing Catholicism away. And so that's something important to consider when caring for these patients. So some comparing and contrasting. So professional care, that's our care that we provide, professional caring. Western medicine blames pathogens for illness, right? Your child has otitis media, there's a bacteria infection. Whereas Hispanics blame spirits or imbalance. When I was doing my informant, he said that his mother would have breast milk put in their ears when they were little kids, and that's what, if they didn't wear hats and they got some an ear infection, or the nieces or nephews got an infection, they would put breast milk, and that was what the practice was. It was you, Madonna, I'm telling you. So, and certain kinds of ointments they would rub on the skin to remove the toxins. Another big thing about care of the Hispanic population is their sense of time is very different. In the Midwest, we're prompt, aren't we? Your appointment's at 9 o'clock, you better be there 15 minutes earlier, you better have your prescription bottles ready and ready to rock, right? When you come and see us in the healthcare center, right? We're very timed. 15 minutes later, your appointment's gone. The Hispanic population, the morning may, 9 o'clock may mean morning, and so that may be 11 o'clock. And that's a barrier that that's something that we have to work with our patients and teaching them that, our society is very much time constrained. So again, back to the self-assessment. Can you culturally be congruent if you don't know your own culture? Thoughts on that, ladies? And gents? You guys are a lively bunch. Joel?
Minimally, but not to the maximum, because you don't know your own.
Yeah, you don't
Like
know
they
your
say,
own. You have to know yourself. Exactly. You have to know yourself before you can kind of get to know other people, right? Many of you guys have cultural practices that you're just not even aware of. And you can kind of start by tradition. What is your family tradition at Christmas time? We have the holidays coming up. Is there something different or something that your family just does? Madonna's shaking her head yes.
I don't know if it's just my family, but I know if I changed my menu, I'd be shocked.
So you see how that is a tradition that is tailored to Madonna's family. Anyone else? Otherwise, we're going to make Marty talk. Marty, traditions at holidays? Not anymore.
If you go to midnight mass, or if you go to mass before, or some religious practice that you might do, or...
How many of you guys...
I just walk out and come
It's Madonna. It's Madonna. So we talked a little bit about it's you. We've talked a little bit. How many of you guys have seen some Hispanic cultures that have the red little bands around their children's wrist? Have you guys seen that? They believe that keeps the evil spirits away from their child, the little red band. So that would be very important. If you had a patient who was in the hospital, you wouldn't want to cut that off because they need that more than ever. Well, we think about it. Okay, child's going into surgery, everything's off. Get the scissors and cut that little band off, or their little bracelet. You would not want to do that. Another thing is, how many of you guys have heard about the evil eye? It's not appropriate unless you're given permission to oogle and on a new baby, a Hispanic baby. You don't do that because they believe that invites evil spirits. I'm checking out on that baby. So here, let's talk about some stereotypes now. The Hispanic population is a huge group. It's from Mexico, Puerto Rico, Cuba. Everybody's encompassed in this. So it can be a first generation, like my informant, the one I did the assessment on, first generation, or it can be someone who was born in the country. They're all encompassed. So basically, if you get nothing really else out of this presentation, this is a group with a lot of diversity into it. We cannot clump them all together, even though in America we do. Professional health practices are formally and cognitively learned. Again, this is what you guys are doing right now. There's skills gained through education, so you guys are getting some skill on working with this population. In the U.S., the population is estimated at 51 million. So it's the second largest group. However, and we have them all come together, but there's many differences in this population. Professional health practices, they do not do everything the same. They're very diverse. Stereotypes, we cannot ignore them. They're individualized. There's differences. And so sometimes it's just asking the question. Asking the question. Many things influence the practice. So numerous factors. One thing my informant really thought was that language. He never had never had an eye exam because he didn't realize that that was important. Because typically Hispanics don't believe in preventative care per se. Their preventative care is much different than ours. So they don't go to the clinic to get an eye exam. He didn't think anything of it. The world just opened when he got his new pair of glasses. It was like the lights were turned on. He said he just didn't know that happened. His eyes didn't hurt. He didn't get headaches. So preventative care is something that they don't utilize. And it can be various things. It can be cost. It can be a knowledge deficit, language, and a lack of access to preventative care. It's not aware. When you first come into this country and you are, trying to establish a job and your family, the last thing is, oh, I better go take my children for a well check. It's just not a thought process they're even thinking about. So they're more likely to seek those generic and folk care practices. What works? My child's been crying all night. Okay, who's breastfeeding? Can they put some breast milk in the ear? So those are things that they're going to seek. And the Hispanic population has a huge problem with diabetes and hypertension. Why do you think that is? What'd you say?
They eat so much because starved country when they come in, so much food. They eat so much. Lack of exercise.
Yeah, absolutely. And it's got to be very stressful coming to a new country, and they don't believe in preventative care. So maybe when they get headaches because they have some symptoms of hypertension, they're not seeking preventative care. They're not seeking the health care services. They wait until they have a heart attack and they're coming through the emergency room. Does that make sense? Because they don't seek that preventative care. And then there's another piece to it. Worsening health, and my informant explained this, worsening health is associated with spirituality imbalances. One of the informants, his brother is suffering from depression because he didn't want to come to this country. His parents are at home, but he had to come. And so he's thinking, he's depressed. And his mother advised that he, it's a set date that he has to go into the river and listen to the waves, and God will speak to him what is missing in his life. And, because he's suffering so much from depression. So it's believed that there's a spiritual imbalance. So the informant's brother is very pulled because there's Western medicine that says, okay, you can take a pill for not feeling well, where his mother and his traditional beliefs are saying to go in the water, pray more, and he'll receive his answers. Is it normal to be depressed if you left everything at home and came to a new country where you can't speak the language and you work a job and send your money home? So another thing is folk healers, and actually the informant, his mother sought a folk healer, and that's what she suggested. Oftentimes a folk healer is a woman, it's usually an older woman with more experience, a folk healer in a Hispanic culture. And then there's another belief about illness is viewed as hot or cold. So, any of you guys hear about that? Hot or cold besides Madonna? I see Madonna smiling. Hot and cold. Illness is seen as a hot or cold, so it's an imbalance. We all want to be warm, right? So if you have a certain illness, it's considered a cold illness or a hot illness. So back to Dr. Langer's theory. So she said to provide culturally congruent care, there's three modes that we have to do. Cultural care preservation. So we want to maintain, I have to put it back on myself. We want to make sure that we're preserving the culture because we don't want them to change culture. We want to maintain their culture. We want to do a cultural care accommodation. So what can we do? An example of this accommodation is maybe if someone is dying, we may want to have the last sacraments for them because that would be preserving and accommodating their unique needs. And then cultural care repattering or restructuring, we don't want to come across as we are the experts. We don't want to come across as we're the experts. What can we do? What can we do to help them facilitate their current practices and making it better for them? So for example, my informant, his brother maybe should pray in the water, but also maybe a psych consult to see if there's an antidepressant pill that would be helpful. So it's working together. It's working to find out what is unique and what is therapeutic for that particular patient. A one size does not fit all. So breaking the modes down, the cultural care preservation, we want to assist, support, and we want to retain that culture. That culture is very important because that's who we are. We want some benefit to the client. And a lack of knowledge on Hispanic culture, that plays a factor in our problem or our situation of caring for this population because we don't understand their culture because it's so diverse. One size does not fit all. We have to remember language is a key issue. How do you communicate with someone who maybe can't understand the language, or maybe they understand it, but they can't verbalize questions? They're not making eye contact. So what do we as the nurse think? They're not listening. And we give them written communication. We're assuming that they can read. It's not a given when we give written communication in our discharge teaching that they can read. We assume. So the accommodation or negotiation, we want to be creative in providing solutions. We want to use what works for them, and we have to make sure that we are aware that language is a huge issue. What does Mayo do for language barriers? What? Get an interpreter. Yeah, very good. Getting an interpreter. Another thing that has to play into a factor is sometimes it has to be the same gender role. It can't be a male being a translator for a female. It has to be gender to gender, or should be gender to gender. That's very important to know. And then the repattering or restructuring. So many things go into restructuring. We do not come across as we know the answer, we're superior. That is not the goal. We may need to use that folk healer and getting them involved because we want to make sure that they're culturally congruent. We have to be aware, is illness viewed as hot or cold? One of the examples that I was reading when I was preparing for this project is that if someone is, if a Hispanic individual is in the hospital and has a worsening of their diabetes, so let's say they're on an insulin drip or they're receiving insulin, and we bring them food that is considered a cold state. So their foods, certain foods like pork, for example, if that alters that state, they're not going to eat that food. So you're giving them insulin to get their blood sugar down. You leave their tray, right? Because we put their tray down. We do everything we're told. Okay, it's lunchtime, so they need a tray. We need to feed them. We're doing all that. But if it's not culturally congruent, are they going to eat that food? What happens if they are receiving insulin and they're not eating? They could die. So it's understanding their culture and making it very much tailoring it to them. So very important, tailoring their unique culture to them. So what questions do you have for me?
Quote unquote patient diabetic in the hospital. And this is something that a good Catholic, and he refuses to eat.
That's a great question. I would ask, what can you eat? How can I help you? What can I get for you to eat? It's asking the question. You know, we won't have all the answers, will we? You don't know. But what have you eaten in the past? Or what can I get you? It's very important that you're eating right now. What can I help you to find? And sometimes it's just that easy. I remember when I would deliver a woman from a Hispanic culture, and after she had given birth, you know, I'm assuming, what do you want to drink? You want pop, cold pop? You want ice water? What do you want? She wanted warm things, warm broth. So she didn't drink the fluids. I thought, that's so weird. She's breastfeeding. She's got to push fluids. Well, where it lacked with me, because I didn't know she was practicing the hot and cold. I needed to give her warm fluids because she had just lost a lot of blood and a lot of warm fluid, and I needed to replenish that. So pushing fluids wasn't pop, and it wasn't ice water. So asking the question. And I wasn't even culturally aware to ask the question. Other questions?
Were they reluctant to talk to you?
I'm sorry?
Were they reluctant to talk to you?
No, actually they really weren't, which is surprising because they weren't. If you ask, and people read body language, they say up to 90% of communication is body language. If you're genuine, that's going to come across. You know, how can I help you? What can I do to make it better for you? What other questions do you have?
Sorry.
No, I want you to ask questions.
When the kids have a diarrhea infection like this, maybe they put a breast milk in it, take care of it.
That's a good question. Some of the, there would be, my informant said that how they cared for ear infections when the kids got sick is someone who was breastfeeding would put breast milk in the ear. Well, what do we know about breast milk? Well, there's lots of good stuff in there. There's bacteria fighting capability. It also lubricates the ear because there's protein in it. So did that help? They said it did. And I don't know. I know people use breast milk for pink eye. Yeah. Your kid's got pink eye? You don't need to spend the money to go to urgent care. You're going to school tomorrow, kid. Yeah. So those are some of the things. And so, you know, we need to facilitate that. What works for them? And body language does a lot of things. You know, if a Hispanic woman asks you, can I put breast milk in my kid's ear? I think if our demeanor was, you know, well, we can explore that versus what? You know, you see the difference in body language. So even if the language is different, care is universal. You can tell when someone cares about you. Well, thank you guys. You've been a wonderful sport. Thanks, Madonna.
Thank you, Maria.
Good job.
I like the indie. Care is universal.
Yes, I need the evaluation on the back. You can flip it upside down, be truthful. I'm not going to say whose handwriting it was, the last page. Can you just pick upside down?
Our name or?
You don't have to put your name. You can just put student, SDN, or you can just put student, whatever. So what I'm going to do with your evaluations, I won't even read them. I will have Shelly type them up and put them in a group. So So I'll get overall feedback. So if you write something that's nice, because I'll see that. Otherwise, it's going to go into like a statistical group. Okay, you sure you can just flip them over? You bet. It's good. It'll be definitely. Okay. Thank you. I couldn't help but stare at you, but I'm sorry. I was like, okay, don't fall asleep. Thank you.
Are we testing for PowerPoint?
No, I figured you guys would fall asleep if I said no. Thank you. Oh, with this? No, the PowerPoint's yours. Oh, okay. The masterpiece is yours. Thanks, guys. Thank you. I appreciate your feedback. Thank you.
You're welcome.
You cannot imagine how happy I am that it's over.
What?
You cannot imagine how happy I am that it's over.
I bet.
How long have you been working on it?
I've been working on it all semester because so many different pieces go in, and the thing is it wouldn't be hard to lecture on Hispanic culture. That wouldn't be hard, but you have to incorporate it into her nursing theory, and that's what made it hard. And to not make it choppy.
How many people did you talk to?
I only talked to one actual person, but I have like 50 articles that I have to cite. Yeah, this is worth 320.
Holy. Wow.
So now I have to edit it, and and it has to be a quick swipe up. They don't want to see like exactly the students. That's why I was like flipping back. They just want to see that because they must have been duped before.
Doing it alone into
Yeah.
an empty room.
I have to just put it in the stack. So let's come into it. Apparently. Oh, that's okay. I'm just giving up to Shelly, so she'll correlate them. Thank you.